Assalamu alaikum. Today's topic of discussion is how to approach heametemesis, that is blood in vomitus, and we will take it as decompensated chronic liver disease due to hepatitis C. So, if the patient has a presenting complaint of blood in vomitus for last 1 day, how we will go with its history of presenting illness. My patient, known case, not diabetic, not hypertensive, known case of hepatitis C for last 8 to 10 years, now presented with a complaint of blood in vomitus, which was sudden in onset, episodic in nature, with 7 to 8 episodes in last 1 day, and each episode contains 1 cup or 2 cups of bright red colored vomitus mixed with food particles containing blood clots. So you have to describe this FVCC along with no association with time. There is also history of black tarry stools which are foul smelling, difficult to flush, 2 to 3 episodes in last 24 hours. However, patient denied any bleeding from any other orifice of the body or any use of blood thinning agents, and there is no relieving and aggravating factors. There is no history of history of abdominal distension, any fever, any history of loss of consciousness you can mention in that. Then the second paragraph, we are going to rule out the differential diagnosis, keeping at above chronic liver disease with portal hypertension, which we will discuss in the, because it's a lengthy one, you have to tell about the etiology and risk factor of hepatitis C. So we will take it in the care. Starting from peptic ulcer disease, there is no history of any chronic medication, that is any steroid intake or any stomach medicines, any preceding history of vomiting or retching, any use of alcohol intake, weight loss, lumps and bumps in the body, any difficulty in swallowing, or chronic epigastric pain which is not relieved with medication, any feeling of heaviness in the upper abdomen, any decreased urine output, any previous kidney issues, any pedal swelling, any history of previous blood disorder or any malignancy. Then comes the care. In the care, as I mentioned, that we are taking it as chronic decompensated chronic liver disease due to hepatitis C. So how it was diagnosed? 8 years back, history dates back 8 years ago, when my patient got his routine checkup on the complaint of fatigueness, and she was diagnosed with hepatitis C, and she was given medication, 3 months medications, which was sponsored by the government. Later she didn't got follow-up. How did she got hepatitis C? You have to rule out all the risk factors. There is history of dental procedures and tattooing, sharing nail cutter among the family. However, she denied history of any blood transfusion, sharing needles, sexual abuse, IV drug abuse, and nose piercing. So you have to rule out all these 7 factors. And there is no history of any hepatitis B infection or alcohol intake. Then, other than hepatitis C, you have to rule out other causes of chronic liver disease, even if they are not present in your patient, like non-alcoholic fatty liver disease, that you can ask. There is no history of diabetes, hypertension, any excessive abrupt change in weight, that is weight gain and weight loss. There is no history of any skin changes, darkening of skin complexion along with joint pains, any abnormal movements of the body, any itching over the body, fatigability, any yellowish discoloration of sclera, any joint pains, oral ulcers, skin rash, any Hakim medication, any loose stools or blood in stools, any family history of shortness of breath along with liver disorder or whistling sounds in the chest. So this is all covering all other causes of chronic liver disease. Then comes complications. As we all know, chronic liver disease, when it gets decompensated, then patient can present with abdominal distension. If your patient has, there is history of abdominal distension along with pedal edema, which is not painful, and it is the patient is not having any fever. There is no history of any pain in right hypochondrium or yellowish discoloration of sclera. Then there is no history of shortness of breath which worsens on standing. There is no history of altered state of consciousness. And then association, there is no history of any skin rash over the body, any pigmentation, or any skin rash which worsens with sun exposure. For Porphyria cutaneous tarda or for lichen planus, you can go for any purplish rash over the body. Then if the patient is already on treatment and taking drugs, you have to mention the side effect of treatment over here, like diuretics if he is taking. If he is taking any beta blocker, then you have to mention here, and along with its side effects. Then in the next paragraph, same as before, you have to mention the investigations and treatment she has been taking up till now since the admission. Then same as before, past history you have to cover. You have to cover the family history, allergic history, travel history, vaccination history, if she is have been vaccinated for hepatitis A and B or not, the functional status of the patient, whether she is mobile or not, how it is affecting her life, in the self-care, in occupational, in home, at every aspect. Then the socioeconomic status. So this was a short history of upper GI bleed. Thank you.